Hi everybody, welcome into the NDS Positive Health Outcomes webinar series. This webinar around the importance that food and nutrition play in health and wellbeing. I'll just give everybody one moment to start filtering into the webinar before we commence. Thanks so much. Wonderful. Well, we're right on 3 p.m. Here in Victoria and 2 p.m. in some of the other states. The time zones have been quite tricky for us at the moment. So I'd like to welcome everybody to the NDS Positive Health Outcomes webinar series. And this first webinar being the importance that food and nutrition play in health and wellbeing. And we have our guest presenters from Victoria University and Western Victoria PHN joining us today. So as we start this session, I'd like to do an acknowledgement of country. So I'd like to begin by acknowledging the traditional owners of the land on which we are meeting upon today. I'm in Victoria, so the Wurundjeri people of the Kulin Nation, and we pay respect to their elders past and present, and any community members with us today. Of course, this is a national webinar, so people will be joining from different lands across the nation. We'd also like to acknowledge that Aboriginal and Torres Strait Islander people have a deep cultural, spiritual and historical connection to country, skies and water, and that sovereignty has never been ceded. As we come together today, I think it's also very important to turn our minds to closing the gap and the health inequalities that many Aboriginal Torres Strait Islander people face, particularly Aboriginal and Torres Strait Islander people who have disabilities, and there's a higher rate of disability amongst the communities. And so to be thinking about what we can all be doing as part of our work to address those inequalities and the importance that nutrition plays, thinking about public health and social determinants as well. So just to do a quick overview of today, so I'll have been opening the session and just providing some briefing, and then we'll dive right into the session with Victoria University and Western Victoria PHN presenting their really innovative and evidence-based work here today. We'll be able to take some audience questions later in the session. So we'll be using the Q&A function in the webinar here today. So please feel free to use that. At the end of the session, if we've not been able to answer all the questions that have come through, the team will look at being able to respond and sharing that when we share the slides in the days following the webinar. I also just wanted to say that live captions are available today. And so my colleague Ksenia will pop that link into the chat. And I also wanted just to say that there'll be a brief evaluation questions at the end of the session. And we really value people undertaking those at the end of the session. So we'd so appreciate it if people could do that. And then the final thing is today we are recording the session, so we're able to potentially share it with others. So if you do ask a question or you come on to ask a question, please just be aware of that when you do so. Now, just to frame today's webinar, part of the reason that we're showcasing lots of health and health-related work is because NDS is undertaking the Positive Health Outcomes Project, which is a national project supported by Department of Social Services. So the real focus is around uplifting disability services, around their skills and knowledge in providing quality and safe supports to people who use their services. So the areas that we're really focusing on are around health supports and health promotion, the quality use of medication and hospital discharge. But of course, today's session is really focused around the importance of nutrition. And so the reason that this ties in with these positive health outcomes is that we know people with disabilities have lower health outcomes and life expectancy compared to the rest of the population who does not have disabilities. there are significant barriers that people face in accessing person-centred health information, in having supported decision-making around their health supports or nutrition, and also about ability to access health services. So this is really why we wanted to showcase this work, connect with this work, and talk about and have our colleagues from Victoria University and Western Victorian PHN share their work and expertise around nutrition and the essential role in health and quality of life that this work plays. So I just wanted to share that brief framing with you all. And on that note, I'm going to pass it over to my colleague, Monica, who's going to take us forth. Thanks so much, Monica.
Thanks, Pip. And hi, everyone. Welcome to our conversation today about health and nutrition. It is really great to see so many people in attendance. I'd like to start us off with the next slide, please, Pip, to acknowledge the ancestors, elders and families of the Wurundjeri people of the Kulin Nation, who are the traditional owners and custodians of university land. As we share our own knowledge practices within the university, we pay respect to the deep knowledge embedded within the Aboriginal community and their ownership of country. On the next slide, a quick introduction to us, who is presenting to you today. So I'll go first. So picture is first there. My name's Monica Wellington. I'm a PhD candidate at Victoria University looking into the meaning of food and nutrition for people with intellectual disability and the way nutrition services work. And I'm also a dietitian working in the community within the NDIS, so with clients with disability as well. Helen, would you like to introduce yourself as a part of the VU team?
Yes, so I'm Helen McCarthy. I have a background in paediatric dietetics, so I spent nearly 20 years working as a children's dietitian in the UK, which a large proportion of that time was spent working with the children and their families with a wide variety of disabilities. But currently I am the lead for the nutrition and dietetic programs at Victoria University. So we have 2 undergraduate degrees and a master's degree in nutrition and dietetics. And within those programs, we do a lot of community outreach and working with partners, because we, as VU as an institution, sees that its role is to support its local communities as well as to provide an educational base. So yeah, that's me.
Thanks, Helen. And Helen and I are coming from Victoria, presenting today in partnership with the Western Victorian Primary Health Network, Kerry and Nicole. So Nicole, would you like to introduce yourself?
Yes, sure. So my name's Nicole Radford, and Kerry Robinson was unable to be here today, but we're working as the project managers for what we call the SPIDER project, which stands for Supporting People with an Intellectual Disability to Access Health. So just a little bit about us. So Kerry comes with a strong understanding of disability from having a family member with complex high needs growing up, and over 30 years of working across a range of community services and disability and mental health programs. Kerry's a strong advocate and very passionate about the promotion of inclusive practice for all members of the community. And I'm also really passionate about everyone having the right to access the healthcare services in the same way as every other member of the community.
Thanks, Nicole. Next slide, please, Pip. So in our discussion today, we'll speak broadly about nutrition as to set the scene to why nutrition is important for our health and well-being, particularly in the lives of people with disability, and share with you some of the resources, some of the responses that we've made in the partnership between VU and SPIDER to the concerns that we've heard in the sector. Important to note that we will interchange between using the word food and using the word nutrition. So whilst nutrition is important, we don't eat nutrition, we eat food. So please note that we'll work between the two terms and discuss broadly about how food is on a huge spectrum, and we'll unpack that as time comes on. I have 3 questions to pose to the audience just to reflect on your own food life, and then we'll talk about what those questions mean in the lives of people with disability as well. So the first question is, what food decisions have you made today? Maybe you got up, you made some decisions about food, you made a decision about lunch. What kind of decisions have you made today? The second question is, where did you learn about food as a kid and as an adult? And the third question, where do you go for nutrition information? If you want to know something about nutrition or a particular food, or you've heard something new, where do you look for information about that? We'll come back to those questions. The next slide, please, Pip. Give us a bit more of an overview of that partnership between BU and Spider. I'll hand it back to Nicole to talk about that.
Sure, thanks, Monica. So as we mentioned, the Spider project is supporting people with an intellectual disability to access health. And Kerry and I work at the Western Victoria Primary Health Network. That's one of 31 different primary health networks throughout Australia. And these organisations work in their local areas, supporting primary healthcare professionals to provide high quality health outcomes for members of the community. So we have been funded as part of the Primary Care Enhancement Program, as part of the National Roadmap, which I'll speak a bit more on coming up. But there's a 10-year plan to improve the health outcomes for people with an intellectual disability, and that's where our project fits, and it's funded by the Commonwealth. So food and nutrition came up very early as an area of need in our project. And so we connected with Dietitians Australia and then also looked locally. So we're based in Victoria. So then we were connected with Monica and Helen, which has been a really exciting partnership. So we've been working together on some food and nutrition resources and different programs being delivered. So overall, the Spider project aims to improve how primary healthcare services are delivered to meet the needs of people with intellectual disability and to reduce premature deaths. So as Pip mentioned before, people with intellectual disability die prematurely of potentially preventable causes. So it's estimated that it's actually 27 years younger that people are passing away, which can potentially be prevented. We want to highlight the importance of food and nutrition in today's webinar. Next slide, please. Thank you. So a bit about the timeline. So the Spider project that Kerry and I work on commenced in March 2021. It was really important to us that we used a co-design approach. So we talked to people in the local community, people with lived experience of intellectual disability, supporters, so paid staff, informal staff, family members, and just the general community, as well as healthcare professionals, to get an understanding of what's working in access to primary healthcare for people with intellectual disability, what are some of the challenges, and what are some of the gaps. So through that process, nutrition was raised as a key issue, and that was in particular from parents with adults with children with disability. So that was really key to starting us off on this journey. The National Roadmap for improving the health of people with intellectual disability was released in July 2021, and that's where our project fits within. So then moving on from there, we connected with Dietitians Australia, as I mentioned, and we wanted to highlight that nutrition wasn't necessarily a major feature within that broad national roadmap. So we connected Dietitians Australia to the Department of Health and Aged Care so that that could be advocated for, and really highlight the importance of dietitians and food and nutrition in overall health and wellbeing. We had then also connected with locally based Victoria University, and that had commenced our partnership. So we had Monica and Helen present to our stakeholder group that we ran throughout the project, and that included disability service providers, representatives from NDIS, National Disability Service, and a range of other services as well. And then there was key interest from disability service providers in particular to participate in some of the programs that Victoria University were running. So we supported facilitating those connections between Victoria University and some of the local disability service providers in the region that we work. We developed our foundational project report about Spider, which really highlighted all of the learnings from that co-design process of what we heard, because we wanted to make sure we heard all this information, but we wanted to make sure that we were reflecting that back to the community. So that foundational report is available on our project's webpage that's still available to download. Then in June 2022, we funded through the Spider Project for Victoria University a few dietitians to complete the Easy Read training so that they could upskill in learning how to create information and resources in easy read formatting, which is really important to make sure that we're considering when we're working with people with intellectual disability and other disability types. How are we presenting information and how are they interpreting that? And is it in a way that's suitable to them? So we've supported the Easy Read training, which is now featured within the curriculum at Victoria University, which is very exciting. And then from there, the Victoria University delivered some of their programs, which Monica will speak a bit more to later, which is the CHEW program and the menu project. So I won't speak to that. I'll let you go into that a bit more, Monica. And then our ongoing collaboration is looking at those nutrition resources and sharing those more broadly, and also participating in the advisory group for Monica's PhD that she mentioned, and also just ongoing advocacy about the importance of food and nutrition in the lives of people with intellectual disability and how that impacts overall health and wellbeing. And as part of the Primary Care Enhancement Program, the Council for Intellectual Disability, CID, has developed some resources. So we'll just play this short video of Laura talking about how she's working with her dietitian.
Thanks, Nicole. Just bear with me while I switch screens.
Laura and her dietitian work together.
I have a very good dietitian. She's very warm towards me, compassionate. She's very understanding, and I talked to her anything. I learned from her, like she printed out what is non-inflammatory, what is inflammatory food. That I haven't learned before. And the other one, like read labels, she said to read labels, drink plenty of water. She doesn't say good for me. I actually said what I want to achieve. She gave me like solution what I want to do, how to be fit. Yes, very empowering too, yes. And it gives me confidence. Giving me option is better than giving me restricted practices, yes. And then I can make my own decision, yes. What I would want to do, yes. And I have a better health.
This video was created using funding from the Australian Government Department of Health.
So if you didn't know what a dietitian does, I think that video highlights perfectly about the work that dietitians can do in the sector, which is great. So as Pip gets the slides up, we wanted to provide a bit more background information about nutrition and why it is important to health and why is it important to choice and support. So to talk about the health perspective, on the next slide, we'll hand it back over to Nicole to chat about the work that the Spider Project did in the background.
Thanks, Monica. So nutrition and food makes up a really key, vital part of everyone's health and wellbeing. So I'll just go through in the green box here. This is the information that was presented in our co-designed final report, that foundational report, which really highlights that food and nutrition form a part of our everyday lives. Every day we eat, every day we drink, and it has a really big impact on our health and wellbeing. So while it's nice to have delicious food that might be not so healthy, it's important to acknowledge that while that might be nice in the moment, overall, that's not necessarily going to be the best option for our overall health and well-being. As well, some people with disability experience sensory issues around taste, textures and smells of different foods, which can impact on meal times. So that's why dietitians can also play a really vital role in supporting health and well-being around food. Often unhealthy food choices can be used as treats or it's the easier option, but then that can lead to different chronic health conditions like obesity and diabetes, and that can have long-term health consequences for the person. And disability service providers often experience challenges navigating around choice and control for the person versus duty of care and responsibilities. So the example is such as when a person has been recommended a meal plan from a dietitian, but the individual regularly wants to choose food and drink that are not necessarily in line with their meal plans. So it's really important that everyone supporting a person with a disability has a strong understanding of what good food is and how to make good food choices and encourage that for the people that they're working with, just to support our overall long-term health. And just on the other side of the screen there with the national roadmap, that just highlights some of those key statistics, which I mentioned earlier, that compared to the general population, people with intellectual disability, in particular, experience higher rates of physical and mental health conditions and lower rates of preventative health care. So that ties in really closely with this food and nutrition side of things and the impact on health. Thanks, Monica.
Thank you. So we've heard nutrition is important for health, but we do use day to day, we do use food in so many different ways. So it's equally important. Food plays a large role in our psychological health. So the way we might use food for emotional support or stress support or those type of things, and the way we use food for our social health as well, interacting with food, socializing around food, cultural aspects of the way food play in our life. So food important for health, important for social health, important for psychological health. But food access, and particularly for people with disability, is complex. It's not very straightforward. So coming back to the first question I asked you, what food decisions do you make day to day? Perhaps you've made a decision today about food, about breakfast, you know, what to put on your toast. Perhaps you made a decision about when to have a cup of tea or what coffee shop to get your cup of coffee from this morning. Perhaps you've been to the grocery store to purchase dinner. Perhaps you decided where to store that at home in the pantry or in the fridge. Perhaps you decided how much money to spend at the grocery store as well. Those kind of decisions that we make day to day, there's quite a few. The people with disability and their self-authority in making food decisions day to day typically depends on where someone lives, who else is there living in that setting, the way that they're positioned within that setting, and also the availability of support with those decisions day to day as well. Now, going to the second question, where do you access information if you wanted to know more about a particular way of eating or something new that you've heard of? Where would you go for more information? And perhaps your answers in your head might be that you jump on the internet to have a quick Google search. Perhaps you ask a friend, perhaps you ask your partner or someone else around your house, or perhaps you go to your GP or your health professional, another health professional, for their advice as well. So for people with disability, and particularly intellectual disability, it's common that they seek information from people closely around them. And in some cases, this can be concerning, because we know in the literature reports that paid support workers have lower nutrition literacy. They come from various backgrounds and therefore bring beliefs, food cultures, food diets, those type of things from various backgrounds as well. We know in the literature that they lack confidence in managing chronic health conditions or knowing where to go to access information about chronic health issues, and also experience barriers to accessing in-service training, so providing information to them about healthy eating and using that information in practice practically as well. But if someone was still to seek nutrition information from people close to them, so perhaps that's a parent or a carer, perhaps that's a disability support worker, perhaps that's a friend or a sibling or a spouse, those supporters, those people in that person's life, have a responsibility to respond to their questions accurately, or as requested, can advocate on their behalf of their health and well-being. So if someone can't make healthy decisions for themselves too, they do need to rely on the people around them for accurate assistance, for meaningful assistance. People have the right to a healthy life, and with that comes availability of information to choose quality of life. So not only does the responsibility of having information about nutrition with the person, but it also sits with those people around them in their care team too. One of the ways that we can achieve or gain information about healthy eating is through public health nutrition messages, but we know that traditional health promotion strategies aren't accessible for people with disability due to various reasons. But perhaps a practical and tailored education is one of the solutions that we could use to help individuals gain knowledge and improve their nutrition literacy. And that's one of the things that we aim to do at Victoria University in the CHEW program. So we'll jump onto the next slide, please, and I'll pop over to Helen to talk about the CHEW program in more detail.
Thanks, Monica. Thanks, Pip. So VU CHEW stands for Community Healthy Eating and Wellness, is a 4-week program that is delivered by our students. So the pictures you can see here are actually pictures of our students delivering the education to a group that had came into us last year, the year before, end of the year before. But we were able to take some photos. We were able to, we made a little video about it, and you can actually access information about the CHEW program on the Vic Uni website if you just type in CHEW to the search page. But basically, it's a 4-week program. The students are supported by qualified nutritionists and registered nutritionists and dietitians to actually develop and deliver education that's targeted to the needs of a particular population group. And predominantly the populations that we work with CHEW is the adults and young people with intellectual disability and mental health problems. So they actually focus one topic a week for 4 weeks. The sessions run that there's sort of an interactive workshop. So the first picture you can see with the students are down sitting with the participants talking about this particular activity is eating a rainbow. So they're actually trying to identify the wide range of fruits and vegetables that you could eat that are actually going to provide a variety of different health benefits. And then we complement that by taking the clients into our purpose-built teaching kitchen, and we support them, or the students support them, to actually cook their lunch. So the work is all done by the participants. The students are just there to make sure that everybody's following the recipe correctly, that everybody's washing their hands when they need to, that the food is actually cooked all the way through when needs be. But they cook a meal, and it's usually 3 courses, a starter, a main course, and a dessert. Small portions, because portion sizing is important. And then the students and the participants and the staff that are supporting them, so that includes Monica and myself, we'll sit down and have lunch together, and we chat about what they've cooked and what they've learned. It's a really social, really engaging opportunity. It happens in the final year of our program, and for me, as seeing the students from they come through the door and they're terrified to even speak to their peers in class, to see them engaging and actually doing what they're going to do as a career with a lot of confidence is amazing. But the other bit that actually inspires me, because I'm a practical person, I like working with people, is actually just the relationships that you see the students and the clients building over time, the jokes, the tears on occasions at the last week when they're not going to see each other again, or they're not going to see each other for a few months, because we do run these programs across the year. But yeah, it's a really good opportunity for people to actually come into our spaces and to learn about food and food literacy and how to make healthy choices. Back to you, Monica.
Thanks, Helen. And in another way, we have the VU Menu project. So MENU stands for Meals, Eating and Nutrition for You. The MENU project is a 4-week tailored nutrition education program targeted towards supporters, so those who have a role in assisting food tasks. And in the past, we've had people in paid roles get involved through their services that they work for, and we've also had unpaid carers like parents and family members involved as well. what people receive from that is a tailored education workshop and some take-home materials so that they can put that information that they're learning into practice. We try and make the learnings as practical as possible so that they can be used in the long term. And we also want to make, or try to make, the take-home materials accessible for the people who are participating in the program, so they're supporters, but also so they're transferable for the people that they support as well. We've been running for a number of years and we've evaluated the model over the time. And through the evaluation, we found that there has been an improvement in nutrition knowledge scores, which is great. And some small focus groups, some of the staff have told us that they feel like the meals that they're providing after being involved have been more healthy. So, for example, they've had less salt, more whole grain options, more vegetarian options, so a bit more creativity about their meal planning. And some sites have shared that they've had some weight loss for their clients, or that are eating the food that they provide as well. And then from an organisational perspective, they've shared that they have more confidence with the meal planning process and more communication between staff members too. So it's improved the efficiency of the service that they've provided. In our small evaluations, we always ask about what's next, or what are ongoing challenges that they are experiencing, and how does that play out, or what do they think is playing out for people's health because of those challenges. And they share with us that staff come from various backgrounds. So again, bringing that knowledge, beliefs around food, or what they know from their upbringing, into the way that they provide food in their work life. And they share that they need a baseline nutrition education standard. So having that standard could be more consistent in the way that various staff come in for different shifts. They also share that staff and organisations need to dedicate time towards training like this, but often people wear multiple hats. So their time and the different roles within their time can be stretched, which can act as a bit of a barrier. And it's all well and good to provide information to people, but there's still a conversation about, okay, how do we share this information to the people that we support so that they can be more empowered in making their own decisions around food? And that's one way that we try and address, or one thing that we try to address with Menu Project. That's still an ongoing conversation, which we might be able to chat a bit more about by the end of today as well. One of the other ways that we have addressed some of the issues around accessing information. So we know that, there's lots of information out there about health and nutrition, but finding reputable evidence-based materials which are also accessible is really hard to come by. So in collaboration with the SPIDA stakeholder group, which Nicole mentioned earlier, and with dietitians and DU students, we've aimed to address that gap. So through some co-development, we've developed up to 15 materials using easy reading principles, and in which the stakeholder group had a particular input around the topics they thought would be good to cover, as well as the format of those resources. So we got feedback about the content, about the format, and making sure they're easy to read, and was able to use that feedback in the development of resources. So the topics covered in our materials include the Australian Guide to Healthy Eating, so covering different food groups and availability and why those food groups are important too, as well as other common nutrition concerns but in the wider population, but also common for people with disability, like how do we get enough fibre and the right types of fibre to help keep up our health healthy, that type of thing. Excitingly, these materials are going to be hosted on the National Disability Service website, so stay tuned about when they're available and where you can get access to them as well. Next slide, please, Pip. So now that we've kind of set the scene, we've discussed some of the things that we're doing with SPIDA at Victoria University, but what next? What else can we work in the sector to help improve the nutrition of people with disability outside of the things that are available in legislation? And there's been a lot of paradigm shift in that sense, which is fantastic to see, but how can we use that in our practice? The next step, next slide, please. So in terms of research, we need a academic knowledge base that comes from on the ground experience. So there really is a gap in the literature for that on the ground lived experience, where research partners with people with lived experience to develop meaningful solutions to problems in their own life. And that's about lived experience informing the evidence base, but then that evidence base informing how we use policy and practice in day-to-day life. This is an approach that we're doing to nutrition research at Victoria University. So particularly in my PhD, looking at the way, what food means for people with intellectual disability, and looking at the perspectives of people in those support roles around that as well. So if there's anyone interested in being involved in nutrition, or if you know a colleague, nutrition research, sorry, if you know a colleague who is interested in being involved in nutrition research, or if you know someone with lived experience interested in that too, I'd love to hear if you want to get in touch for more information. That'd be great. I'm sure my contact details will be at the end of these slides, which will be available for everyone. But LinkedIn is always a great place to get in contact if you want to get in touch there too. In terms of training, there is a need for additional training. We've talked about that a number of times already today. A training that needs to be available to those people who support with food. So that could be about upskilling our disability workforce, but it needs to also be targeted towards people in unpaid care roles, like the family, like parents, like carers, like spouses and siblings and other people around who help support with food. And that might be directly, like taking someone to the shops or maybe cooking a meal together. That's also about sitting down, having a cup of tea and having conversations about food, or if someone comes to you with a question about food, being able to respond to that accurately. Now, there's two parts of that training which is important to consider. So on that top row there, feeding into the outcomes. So it's important that training is adequate. So training that comes from an evidence base and is also provided by experts. And that might be experts by discipline, so provided by specialist support workers, provided by dietitians, provided by nutritionists, but maybe that's about experts by lived experience as well. And their training needs to be accessible. So that's about including people's backgrounds, or being inclusive of people's cultural backgrounds, communication backgrounds, being accessible in that sense. But it also needs to be easy to access. Where does this training, or where do these support materials be available so that people can take them on, use them in their practice at quick reference? And then two outcomes that training needs to consider is about better nutrition literacy. So nutrition literacy is about the ability to plan, to prepare, to store, and to eat in a pattern of eating that meets someone's health needs. So people in support roles improving their own nutrition literacy might mean that they can make more informed decisions for themselves, which is always going to be a fantastic outcome. But it is also about them having the ability to screen and then have an early response to any concerns in the food intake or concerns in the food behaviours for the people that they support as well. So really passing on that nutrition literacy in an indirect way. And then the other outcome is about supporting carers' responsibility to assist the well-being of those around them. So that's about the social circles that food works in. So we know about food, and we eat in certain ways depending on who is around us in our life. Providing more supported decision-making training to carers and supporters may therefore bring on or have more available reputable information to people with lived experience so that they can make choices, or a choice, to live a healthy life for themselves. The most important thing that we can share from this conversation, I think, is about advocating for improvements to the sector, advocating for the nutrition rights of the people that we support, and also improving the standard of collaboration between staff so that people can feel like, you know, they've got a team around them, a team that works together around them. And that's what I think training and education could make an impact there. Next slide, please, Pip. So we've shared a bit about our works and a lot about our learnings in the partnership between SPIDA and VU, but more importantly, we've kind of sat back and we've actually asked ourselves, what does this mean for people on the ground? So we'll watch another video now, and we'll watch at least 10, we'll try and get through it all. It is a 15-minute video, but we'll watch at least 10 minutes of it. In this video, you'll hear from Robin, who's a parent from the SPIDA stakeholder group, and Marjorie, who's a service manager, and talk about their own perspectives of the importance of nutrition, their experiences in some of the activities that we've discussed today, and their ideas of what they think needs to happen next as well.
Thanks, Monica. Just bear with me while I do the screen switch.
Thanks, Pip.
Okay.
Wonderful. Thanks, everyone.
Okay, Robin, so we're talking about food and healthy eating.
Yes.
So the first question is, why do you feel that diet is important for people that live both in their own homes and also those who live within a community residential setting, supported accommodation?
Well, I don't think it should be diet. I really think it should be good, healthy food eating, good food eating. People aren't necessarily on a diet. They're just on a good health eating program. And I think it's important because it gives them good health and that allows them to enjoy their life. And it gives the body energy. So therefore you can go out and have a jolly good time. And when it takes into account a special diet that's required, it can still be within the bounds of a good food choices. Yeah, that's how I see it.
Nice. So I suppose what you're saying is you see healthy eating as part of a healthy life.
Yes, and you can have the occasional treat and then know that, yes, I'm going to be good tomorrow. Well, not good, but go back to what I usually do with my good health eating.
1 Tim Tam a day.
Yeah, something like that. Then sit on the hands.
So where do you think maybe things might go wrong in terms of eating so that it is less healthy than it could be when you've got people with disabilities living together in a shared environment?
Well, I think if they all sit round and we have the booklet that's been made up, it gives them a chance to look at what foods are there and then they can decide from that. And there's a good choice.
Yeah.
It really is.
So
and
being
the reasons
supported.
why. Pardon?
I guess being supported to make good choices.
Yes, it's against poor choices. And if it's explained why, most times people take it on board and say, I'll give it a go.
Yeah, good.
And it's the same with other diets sometimes. People accept those and to try them yourself, even if you're not on a special needs diet, like a diabetic diet or something like that, it gives you a chance and you can say, yes, I can eat that as well. Not a problem.
Yeah.
Yep.
That's a bit like people who eat meat discover that vegetarian diets actually have got really healthy and interesting taste to them. It's just not mashed potato and a carrot.
Yes, that's right.
Okay. So you were involved last year, Robin, when we did some work with the SPIDA project, and you gave a parental perspective, being the mother of a woman with a disability. Yes. You gave the parents' perspective. Why was it important to be involved in the co-design for SPIDA with the parents' perspective?
Well, I think it when you've been brought up with a good, healthy eating plan, to suddenly go into another place and you really don't know what's on offer, I think we can put in our 2 penneth worth and say this is what we prefer our person to have as against some of the other choices. And it's like portion size. I think if people can get used to portion sizes, it makes a big difference to their health
Yes.
as well, instead of just eating for the sake of eating and to clean a plate, as the
Yeah.
saying goes. And variety of foods, any new foods that come in, particularly in fruit and veggies and that, we were always prepared to give a go. We mightn't like it after we've had it, but at least we've given it a go. And I think that makes a difference to a lot of people's diets too. It's just not the same old, as you said.
Yeah, variety.
Yes.
Variety and eating a rainbow.
That's right. Yes, exactly. And I think it expands your horizons and makes life more interesting, because you think, yes, I'll try Indian, I might try Korean, I might try this and I might try that. And if it's within the bounds of the good health, good eating, well, you're on a winner.
That's so, absolutely. So as a parent of a person living with a disability, you felt it was really important to be engaged where you could give that sort of opinion
Yes.
and encouragement.
That's right. And I also think that if doing this has allowed us as parents to keep up to date with what's the thinking of the moment.
Yeah.
Yeah.
And part of that thinking was last year we also did some work with the VU nutritionist students, and they were running a program for us, which was fantastic, and I'll talk a bit more about that later. But they engaged again with you and some other parents to look at the resources that were being developed. So what did you do with those Vic Uni students to develop the resources?
Well, they presented their papers and that, and we looked through those as a group, and it was pretty good. We had some entertainment with some of the things that came up, but the way it was set up in the different sections I thought was really, really good. And the portion sizes and what could be taken from that, and the nutritional value of the different parts and that.
Yeah. So I think they ended up setting up two things for us, didn't they? I think we had, one was the set of recipes that you looked at. And I remember you'd picked up that there was some of the recipes had used, was it courgette or something? And we thought, what's a courgette? But then as well as looking through the recipes and thinking, yeah, they look appropriate, or that would be really interesting. They did that guide for us on nutrition.
That's right.
Yeah.
Yes. So it all kind of comes together. And I think too, we picked up that some of the colours that they were suggesting or they had made up just didn't work when you were actually trying to read them. I think they had yellow on white. Well, that's
right.
useless at night time, particularly with the light and things like that. And I think the font, it needs to be pretty easy to read, so that if you're really caring for someone that's sitting at the table and they're kind of chopping veggies for you, you can have your eye on them while you're still cooking or working around it. But you need something that's easy read in a way, just the way it's set up on the page, I think, more so than the other.
And pictures.
Yeah. Yes.
That's really useful. I think, and that I think was one of the charms of the recipe book they developed, was it did have really appealing photos of the food. I know that we tried to make some cookbooks ourselves a few years ago, and every photo we took, even the meals looked beautiful, but every photo we took didn't look beautiful. It's very hard to do that professional food photography.
You didn't have the varnish to put on top.
No, that's probably right. We didn't paint the food. So do you think that the resources that were developed by VU will assist supporters to better understand how to identify which are healthy foods and which are less healthy foods, and portion control that you mentioned? And I think the other thing was swapping things. I like that idea. That was good, wasn't it?
That's right. But it was. And I think too, they're teaching people they care for, but they're also learning themselves. And it's just not those two people. It ends up going into the community, because they think, I'll try that at home. So we get healthy people everywhere.
That's good. I love that flow-on effect. Bit of education, and it spread.
Yeah.
shared amongst everyone.
It makes a difference. I think they're conscious of what's around when it comes to food, and just not, I'll grab this, I'll grab that.
And you have mentioned the portion control a couple of times. I've noticed myself when I'm around in any of our shared houses at mealtimes that often plates of food are just heaving, and I think, oh my gosh,
Yes.
there's no way I could eat that. Or
No.
and no difference between what a a small person might be given, and sometimes people look like they're being fed to go out and work on the farm
That's
rather
right.
than
Yes.
sit around and watch TV for the next hour or so.
There's a difference between someone who's very sedentary as against someone that's actually mobile and active, and you've got to take that into consideration as well. But overall, if you can look at your plates, look at your portion controls and good fruit and veg and meat, I think you've got a really good diet.
Yeah, absolutely. Yes, that's right. So here at work at GenU,
yes,
we spend a lot of our time trying to support people around their diets, and one of the things goes back to exactly what you just said about people being sedentary, because as you know, I put the newsletter together, and I've been putting the newsletter together for years.
You can see
and one
the
day I
difference.
thought, oh my gosh, the people we provide support to are oftentimes getting larger and larger and larger, and not because they needed to get larger, but because they're probably fairly sedentary. And that really prompted us to think we need to do something about healthy eating.
Yes.
And I take what you say about not diets, not specific diets, but healthy eating. So that meant for us, we really had to concentrate on the staff as well as the people we support, as well as the residents. We needed to concentrate on the staff because we discovered that really a lot of our staff don't actually know how to cook. It's not part of their Cert 4 training. Many of them, just simply don't know how to cook. So that's
called a steep learning curve.
Yeah, that's right. So we've tried a number of things over the years that you're probably aware of, and we did try putting together our own cookbooks. We've done a lot of work with just downloading good nutrition information from the internet and making sure that we regularly put that in front of staff so that they've got the opportunity to see, how much sugar is in a glass of soft drink, and maybe we don't need that much. And and then we've been working, of course, with Dental Health Services Victoria on our Oral Health Champions network group as well.
That's wonderful.
So a lot of that had meant that we were making sure that that we had gone to much healthier drinks. So we'd gone much more to water on the table rather than cordial and water and cordial down, that sort of thing.
You can always put pieces of fruit into water to give a flavour.
Yep, and looking at fruit for afternoon tea rather than biscuits.
Yes.
And then through the SPIDAR project, we got in contact with VU, and we had a couple of great experiences there because as well as the cookbook that they worked on that you were involved in as well, and the nutrition resource, also through their CHEW program, we had some of our residents who live up closer to Melbourne in the western suburbs. They went along and learnt to do some healthy eating themselves and healthy food choices. We've also been promoting for a number of years the wheeling and walking through winter competition that we have every year to try and get people moving through winter and not becoming more sedentary, and looking at giving out recipes through our monthly newsletter, not the one that you see as parents, but the newsletter that we send round to the houses. We always have healthy recipes that we...
Wonderful. We're just going to pause it there, and I'll bring it back to Monica. But I'm sure everyone appreciated having that real lived experience, hearing about co-design. We know that's so important in all the work that we're progressing at the moment.
Absolutely. Yeah,
Thanks,
I think Robin highlights that nutrition doesn't have to be complicated. We can take simple ideas and put them into practice. And Marjorie highlights that services can value good nutrition and good training for their staff too. So overall today, just some take-home messages that people with intellectual disability have the right to adequate food and nutrition, that healthy eating is everyone's responsibility. And adequate training needs to be available for supporters to promote health and wellbeing in those close to them. And approaches which aim to improve nutrition do need to be co-developed, co-designed, using inclusive and accessible methods. So that slide's good. Let's open it up to the floor. Any key questions we're happy to answer, any comments or anything you'd like to share on top of what we've discussed today, it'd be great to hear as well. If you pop your hand up, we can unmute you so you can speak if you wanted to, or you can pop questions or comments into the chat box as well. And if we run out of time, we can always follow up with questions afterwards as well on email.
Beautiful. I've just unmuted you, Olive. I could see that you had your hand up.
Sorry, I'm saying it's muting, unmuting, sorry. I am a dietitian working in the paediatrics sector in Newcastle, New South Wales. And my biggest problem at the moment is actually trying to trying to access funds for clients to get dietitian support. So the biggest push at the moment in the last 6 months, I'd say on average, we have 50% of all the funds for dietitian support being removed for our clients with intellectual disability. It's been a huge push with multiple LACs and NDIS plan reviews coming back saying that NDIS does not support or pay for dietitians, which we know is incorrect. I was just wondering, in terms of this kind of evidence and support, how do you use this to advocate for your clients in the community? Because obviously there's great stuff here from Vic Uni and great resources, but in terms of making sure they can actually have the funds to access it, that's the biggest hurdle at the moment for especially all the dietitians I work with in this area.
Thanks, Olive. Helen or Monica, do you have a response?
Funding is a massive issue, Olive, and no, we don't have a solution to that. There is a need for us to massively increase our advocacy in this space and to hit the decision makers quite hard with the evidence as to why this is needed and the difference it can make. So things like our CHEW and our menu programs, we're evaluating those as we're going along. We're collating the data so that we can actually produce some reports that'll actually say what a difference simple things like this can make. Similarly, the work that Kerry and Nicole are doing with the Spider Project is actually, and Nicole, you might want to speak to this, is actually about sort of advocating for better resources, but also you know, collating the evidence and trying to develop tools and resources that can be used to improve things with what we've got at the moment. Nicole, did you want to?
Yeah, thanks, Helen. Yeah, so a part of the Spider Project is also around advocacy and providing information to the Department of Health and Aged Care about what we're learning throughout the project. And I also just wanted to touch on your question, which I think was similar to one of the pre-submitted questions that we got, is what resources can be provided to NDIS, to the plan reviewers, to increase the funding in this space. So that's quite similar to what you've said. And we reached out to a colleague at NDIS. So they gave us a web link that they said has some good practical tools for healthcare professionals and a link to the supporting evidence forms. So I can pop those in the chat for you as well.
That would be amazing. Yeah, thank you. Yeah, I would be very excited and shocked if you guys fixed that problem in that one question, but thank you for attempting.
Great, thanks, Olive. And there was a few questions, but we'll just have one more because of the time. So the question is, how do you get clients involved with CHEW or menu with the VU team?
That's Monica's job. Is the quick answer.
Please send us an email, get in touch. There's a website for the VU2 program as well, which has a bit more information, or give us a call, give us an email, and we'll go from there.
I will pop the web link to the TU program into the chat now as well. But as I say, the TU program, it is slightly limited in capacity because we are based in Melbourne, which isn't necessarily accessible to everybody. But if you want to get in touch, we can definitely look at if there is a way we can support you, just because the menu was developed to do something more remotely, to support the wider Victorian area, because we can't get everywhere and we can't be everywhere, but we definitely want to support this initiative and support what's happening more widely across Victoria. But we're also happy to talk to people outside of Victoria about things that we might be able to do to help. I say these are student-led projects. We just sit in the background and make sure everything's going smoothly.
Fantastic. Thank you so much, Helen, for that answer. We're right on time. So I'd like to thank all our attendees for coming and joining today. I found it to be a very engaging and interesting session, and it really spans that link, thinking about nutrition, human rights and health, and how integral that is in quality and safe services. So a huge thank you to Helen and Monica. And so the Victoria University team, and then also, of course, the Spider team with Nicole. So thank you so much for presenting your work. And then we'll have some evaluation questions when you hit the end of this session, and we'd really appreciate if people could do them. It's very helpful. I'll send out the slide deck, and any questions that came up or the resources we'll include in that pack. And on the health front from NDS, we have a national NDS disability sector health issues network. We'll put that link in the pack that we send out, and also to say that we'll have some more health focused webinars coming up. So we'll have mealtime management and dysphagia, which will be hosted by UTS. So we're looking forward to that connection as well with nutrition through to the mealtime and dysphagia work. And we'll also be doing quality use of medication in April and May. So thank you again for all the attendees for coming, and stay connected, reach out to the teams that have presented here today. And we look forward to seeing you at future sessions. So thank you so much, everyone. Have a wonderful afternoon.